Here on Saipan, there is but one facility intended to provide care for the mentally ill, which is the psychiatric ward at Mental Health. But employees of NMPASI, the nonprofit organization known as Northern Marianas Protection and Advocacy Systems Incorporated, have been made aware that certain mentally ill patients, namely those under distress, are being turned away. The problem hits home with NMPASI in light of the island's recent homicide allegedly committed by a mentally ill patient known as Dwayne Sibitang. While Public Health Secretary Joe Villagomez maintains Sibitang escaped mental health, Sibitang's parents allege their son was turned away. Instead of pointing fingers, NMPASI says the problem lies deeper. Programs coordinator Jim Rayfan says what should be an acute care facility has now turned into a long-term patient facility.
We have reports that there are patients who are in the psychiatric ward who've been there for in excess of 20 years, up to 30 years. Again, it's become a long-term patient care. So then, when some of the individuals who are under distress or who need immediate attention are being turned away because they're afraid of subjecting the more fragile patients, the ones that are in there for 30 years, to violent acts of patients who have decompensated.
Another problem Rayfan points out is under the Patients' Rights Act, mentally ill patients should be appropriately discharged.
When they are discharged, and we do have to make that point that what we're trying to do is ensure that individuals with mental disabilities are in the community, but that when they're discharged they get appropriate support, appropriate discharge planning.
NMPASI advocate Angela Bennett says in her experience, mental health psychiatric ward needs to be separated in two, an area for acute care and a less restrictive alternative.
The statutes that are in place appear to be very adequate to cover what is necessary here. It's just that the CHC needs to do what is required, which is to provide a less restrictive alternative for the individuals who have been up there for many years, and also then to allow those individuals who need acute care to come up to the psychiatric ward, particularly when they are requesting services.
NMPASI's executive director Lydia Barcenas says they can help the hospital by being a member of the Mental Health Planning Council.
We were members of the advisory council. However, that thing kind of changed, so we've been requesting to go back, be placed again. That way we would know what's going on and also provide the agency's input.
Besides being able to help individuals who are refused treatment, NMPASI can also help maintain communications between the government agencies and explain what is required of them under the law. In closing, NMPASI stresses that no patient can ever be turned away. If the CNMI cannot handle a particular individual, that patient can be sent off island to an appropriate facility.